attendees, for the people that are joining. Thank you all for joining us today for this opportunity to discuss the future of health data.
Thank you, Pedro, first of all, for the invite and for hosting us all here today. Yeah, I have my Odyssey Netherlands hat on today, and a good question that you're asking there. I think what Odyssey has done, or is doing actually for us in Europe, is that it's greatly facilitating the possibilities for international research. It's given us the OMOP-CDM, which has made it much easier for everybody to collaborate because of data standardization. Odyssey has also given us a standard analytics, making it possible to, to have the whole data analytic pipeline that we need to perform research in a standardized way, which I think is a great way forward to ensure that we are all doing the same thing.
I guess, the NHS as a healthcare system isn't unique in what I'm about to say. It's complex and it's fragmented. And the patients and citizens of England think the NHS is one thing, and wouldn't it be wonderful if that were true? It's obviously thousands of healthcare organisations coming together as a whole ecosystem. And I think it's notable that in the last few years, last 2 or 3 years in particular, there's been a really concerted effort here in England to bring those healthcare systems together and really drive integration and collaboration at scale. And the whole kind of thinking behind that is, how can we take everything that I've just described in terms of this kind of ongoing process of harmonization and interoperability, how can we take that and leverage it to make it easier for researchers to access data to then drive research and development activity?
We should make sure that we keep the energy of finding ways to do the research we need to do. The second thing I would argue is to say we make sure that we don't overdo it, like we don't make it too much complex, too much costly, because of course observational data, the type of research we do with EDIN and all this kind of public health research, we don't have massive amount of funding to do that. So that's something we should be precautious of, to make sure we also make the choices to invest on some of the resources, and we make them sustainable.
Having standards, using interoperability, semantic interoperability, choosing the right catalogs and everything else. This is something that it's quite huge to transform, even for a small group in Portugal, but we have a huge number of hospitals, so it's difficult to have a clear idea on that. But implementing a new EHR with the correct decisions up front, it's obviously a nice step to have.
We're taking two approaches to this. So kind of centrally as NHS England, we are taking a targeted approach to certain standards on our CDM, such as OMOP, where we are kind of formally adopting those across the network. So back in August, it was announced that where possible and where it made sense, we would expect SDEs to make use of OMOP. So there's a kind of centralized approach. But the majority of the work actually is done within the community. So we have
the key to me for the future is, how do we make, and there will be several trusted network for observational research. And I think the model of Odyssey and Eden is one model to follow upon, going forward.
I want to thank the four of you for this exceptional hour, and yeah, thank you for the audience that took part. Feel free to get in touch with us, and also keep an eye on next events that we will host on similar topics.